Good afternoon, my name is Tina Nordine and I'm your FNP student that's going to do Mr. Nordine's lung and thorax assessment this afternoon. Before we get started, I did wash my hands before I walked into the clinical assessment room, and I want to also consent with Mr. Nordine. Mr. Nordine, we're going to be sharing this video on YouTube just with my instructor. It's going to be listed as unlisted, and I want to make sure that you do consent to allowing me to do your assessment today. Do you consent?
Yes.
All right, very good. So today we're doing an assessment of your lungs, and in order for me to do that, it's going to be 4 easy steps. So I'm going to walk you through each and every one of the steps. So first we're going to inspect, then I'll palpate, percuss, auscultate, which means listen. Okay, so first I'm just inspecting you as you walked in the room. I noticed your posture, and I was looking at your chest wall. And in this clinical assessment, generally speaking, we would have the patient disrobe. Now, Mr. Nordine doesn't feel comfortable with disrobing, so my instructor, please allow for that. And also in this assessment, I'm going to be listening to him with my stethoscope, and it would normally be skin to skin. So just so you know, he does not consent to that on video. So we're going to be inspecting his chest wall. We're looking for deformities or any type of concaveness or anything in his chest wall. I don't see any of that. What I'm going to do now is I'm going to look at your AP ratio, and how I do that, I'm going to take my stethoscope and I'm going to take a quick measurement from your lateral side and your chest wall. We want to do that chest wall assessment. This is about what your lateral side is for your chest wall cavity. And I'll measure that, comparing it to the anterior side, and it's about twice that, which is appropriate. So your AP ratio is 1:2. And then we want to look at a respiratory rate, and I would measure your respiratory rate simply by counting your respirations within a minute. So I'm going to look at about 15 seconds worth. And I'm assessing your respiratory rate to be about 16. I would also look at any accessory muscle usage. I don't see any of that. Extra diaphragmatic breathing, I don't see any of that. So it looks like you have normal respiratory rate. The other thing that I'm going to look at is just kind of assess your arms, looking down into your hands and nails. I don't see any cyanosis. I don't see any nail clubbing or anything like that. So again, on inspection, he looks to have been normal in his thorax area and his chest area. And I would do that on his chest wall as well as on his back. I'm looking to see if everything looks good as far as on inspection. And everything that I will do on his front and his back as well. So anterior and posterior views. The next thing that I'm going to do is I'm going to be palpating, and I'm looking at the excursion of your chest and looking at symmetry. And so how I do that is I will place my hands on your chest, and as you take a deep breath in and out, I'm noticing there's symmetry across in your chest wall. So that again is normal, and I can do that again on your back as well. And I will have him turn around in just a few minutes. If you'll take a deep breath in and out, and I'm noticing symmetry there as well. I'm going to take the palm of my hand, Mr. Nordine, and I'm going to ask you to say the word 99. By doing that, I'm testing your tactile fremitus. Okay, it's a vibration between your intercostal spaces. And I would do that on each side of your chest in a ladder formation. So we'll start here on top of your intercostal space. Can you say 99?
99.
Very good. And I do feel a vibration there. 99.
99.
And then I'll move down one more time.
99.
And down.
99.
And down.
99.
All right. And one more time.
99.
And then I'm going to go kind of lateral.
99.
And one more time.
99.
And you look at, we're doing that along on your anatomy. So we're doing that to test for tactile fremitus. And then I'm going to make sure that you have no, as we're palpating, I'm palpating to see if there's any costochondrial tenderness along your sternum, or if you have any tenderness or deformation on your chest, and I do not feel any of that. as well. And I don't feel any type of crepitus either. So you could feel crepitus. I'm not sure. I know you're a nurse as well. You probably have felt a patient that has had a ventilator, and you could feel crepitus along in their chest wall cavity, and I don't feel any of that. So again, that is normal. The next step would be percussion, and we would listen, or I would percuss utilizing my third finger and the third finger of my other hand to percuss in a side-to-side fashion on either side, anterior and posterior, and I will show you that as well. And then we will show you that anteriorly first along the lungs, okay? So we'll listen with percussion for dullness in the intercostal space in a lateral formation across each lung cavity or each lung lobe. We also have lung lobes on the lateral side, on this side, again with my third finger, and I'll do that on this side as well. Now, Mr. Nordian, if I could ask you just to kind of turn just slightly so that our videographer is able, I don't know if she can see your back from here, so that I can show that I'm able to do a percussion utilizing, okay.
This way.
Good? No? Okay, our videographer is asking us if we can turn it this way. All the way around. There you go. Thank you, patient. Very good. And we will do, again, the same formation utilizing the third finger and the third finger, finding in the intercostal spaces, well, there's no ribs on this side, but into the lung lobes, again in a ladder formation. Usually you don't bring your dog into the clinic. We do have dogs here. He is a service animal. That's Checkers. So we have percussed his lung capacity as well, and I have found that to be quite normal as well. So the next step, we also want to test for diaphragmatic excursion. Well, how I would do that is I'll place my, Mr. Nordy, I'm going to place my hands on your back, down about where your diaphragm is, and right at the lower level of your what would be on the rib cage on the other side. So we will ask you to take a deep breath in, and you can see how that, and you can let go, and you can see how in his diaphragm it is expanding and contracting as he takes a deep breath in and back down. So we're looking at his diaphragmatic excursion, and again it is normal in that way. So we have inspected, palpated, percussed. We're auscultating now as well. We would auscultate on the anterior and posterior side. Since he's turned this way, I'm going to go ahead and do the posterior side, and then I'll ask him to turn around and do the posterior side. Oh, actually, we want to do tactile firmitus on the back as well, looking at saying 99. So again, if you could say 99.
99.
And again.
99.
And again.
99.
One more time.
99.
You're doing a great job. And
99.
Uh-huh.
99.
And then on the lateral side.
99.
And one more time.
99.
Very good. All right, and so in order to complete our exam, the last step is auscultation, and we want to do the anterior, like I said, posterior side. We'll do the left lateral, we'll do the right lateral, and the apices. And then in order to do that, I'm going to take my stethoscope, and I'll ask you to take deep breaths as you feel my stethoscope touch your back, okay? Can you take a deep breath? Okay, one more time. Clear, no rhonchi, no wheezes. And again. Very good. And again. And one more time. And then I'm going to do the lateral side. Take a deep breath in. And I'm going to do this lateral side as well. All right, and then I'm going to ask you, you might find this to be, excuse me, I just had my hair washed. You might find this to be a little odd, but I'm going to ask you to say E. And what I'm listening for is if whether his sound sounds like an E sound or an A sound. A would be abnormal. So I'm going to listen again. And as I'm listening, I'm asking you to say E.
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 And I hear E. E.
E.
And E.
E.
And E.
E.
And one more time.
E.
Very good. And then another test that I'm going to do is called the whisper pectoraliquy. Excuse the long word there, but what we're doing is I'm going to ask you to whisper. And as you whisper, I am not supposed to hear your whisper with my stethoscope. So I'll ask you to do that. We'll do that on the back side, and then we'll do it on the front side. All right. Can you whisper something? And again. And I don't know, videographer, but he is whispering here. One more time. And again. One more time. Again. And then we'll do the lateral sides. Okay, very good. Okay, very good. And Mr. Nordine, if you can turn back around for our videographer to get the front side, we can auscultate the front. You don't have to turn that far. Just right there so she can see your chest wall, which is not deformed in any way, not... And then I'm going to auscultate in your lung lobes as well. You can take a deep breath in. And again. And then one more time. And again. And in this situation, if the patient were some males, but most females, if you're needing to auscultate their lungs, but their breast cavity breast tissue is in the way, you can ask them to lift it so that they would feel more comfortable. So I'm going to go right under where his breast would be. Deep breath. And again. And then we'll listen laterally. Okay, and one more time. And then we're going to do that E game again. And you say E.
E.
Yeah, I hear the E.
E.
Very good.
E.
Yes.
E.
Okay.
E.
Okay.
E.
Very good. And so I heard the E sound, not the A sound, which is normal. And then we're going to do the whisper test as well. Can you whisper something? Okay. Very good. And I would do this in the ladder formation in all lobe areas. And then lateral. And I do not hear him whispering, so that is a positive finding. So, Mr. Nordine, thank you so much for allowing us to do your assessment today. We did an inspection, palpation, percussion, and auscultation of your lungs, and today I found that you have no wheezes, no rhonchi, no abnormal sounds, normal respiratory rate, and normal on inspection. So, thank you so much, and I look forward to seeing you in about a year for your next assessment. All right?